Welcome to Healing Through Dentistry podcast,
where we redefine health, wellness, and the power of your smile.
We're your hosts,
Hannah
and Eva, twin sisters, qualified dentists and medical doctors.
This is more than a dental podcast.
It's a journey into profound connection between oral health and whole body healing.
Through personal stories, inspiring client transformations, and expert insights,
we explore how dentistry can ignite energy, relieve chronic pain, and transform lives.
Get ready to discover the extraordinary ways your smile can heal, inside and out.
Let's begin. Welcome to Healing Through Dentistry podcast. This is another solo episode. Eva is speaking. I'm bringing in another transformational story. It's a story of a client I met only a few months ago in summer, so 6 months ago. And I would like to tell you guys what was her story, what are the experiences, what we can learn from her. So let's begin. So this client is coming for our dental examination or holistic biological dentistry session because she found out that there might be a connection in between health of her dental work and in between her conditions. So she is having issues with arthritis. Her joints are hurting past 5 years, and she has also pain which is leading or which is kind of in the place where her titanium implant is. And she is coming back and forth to her dentist, and the dentist is looking at the x-ray images, is looking at the crown, but he is saying that everything is fine. It's not connected with what she is experiencing. Her implants, titanium implant, is in her lower left area, so replacing her first molar, which is the tooth which comes through when we are 6, so the first adult tooth. And the symptoms, the signs of arthritis, of her joint pain and pain in area of her lower left side at the face is about 5 years. For 2 years, she doesn't have a crown on this implant, so she has only implant which is placed and which has a healing cap on the top, so she's not really using the tooth either. She feels that the implant, that area is causing her pain, but the pain which is really bringing lots of sensation, but nobody believes her, and lots of colleagues of this dentist are saying this is okay and it's very dangerous to remove the implant because she's coming with the idea to remove the implant and they're not willing to proceed. So she's looking more into it. She's finding our clinic, biological dentistry. She's basically looking for answers, and she's coming to us in summer. And we are taking 3D image. We're talking about what she is experiencing past 5 years. And the fabulous thing is that she has managed to not to take any medication for the signs she has. She's managing all her signs and symptoms of arthritis with lifestyle. So she has changed what she eats. She has changed the supplementing. She has changed what she's using at home for cleaning, basically non-toxic living. And she also using frequency. She goes to Vicom sessions quite regularly, and that's what is helping her. But what she told me yesterday, what was like kind of 4 months later, we are placing the implant. We have decided to place a zirconia implant. We have found out that she has, next to it, she has one dead tooth, which is root canal treated. So the behind the scenes logistics, because we can place the implant, we can replace the titanium implant. But if we have this side, which is the area of dead tissue, we have to just do it in a complex way, which means that we have to replace also the root canal treated tooth. And just to imagine, it's like a soil of bacteria, viruses, parasites, all the pathogens which are actually, they're affecting the area, they're affecting your systemic health, because all these pathogens, they're in your bloodstream and they are bringing in the bacteria we don't want. and the good bacteria, they don't have any chance to work. So we decided to do the surgery in summer, and I think it was August, and we have replaced the root-treated tooth with the zirconia implant and then the titanium implant. When we were removing the titanium implant, there was a very huge amount of bone tissue which was dead, which was necrotic, which had a big odor. It was just clearly obvious that it's not a healthy bone. What is differentiating titanium and zirconia implants? That's the question I have very often, is that I explain to clients that bringing in this zirconium implant material, we are bringing into the body the life, because that's the area where there could be a blood flow, capillaries, veins, arteries, and that's basically the body likes that material that much, that it's biocompatible, that it's the life, which is the most important we're bringing into the body. Whereas titanium implant, not many people they realize, but the fact of the material is that the body is trying to build a barrier around it, which is the dead sclerotic tissue, which is why dentists, they would say everything is okay because the bone is dense. You don't see any hypodensity, which is like an area where is some inflammation in a liquid form, which is basically when infection. So the sclerotic dead bone is dense, but there is no nutrition, no life, no veins, no arteries, no capillaries, no life, meaning that the immunity cannot get there to clean it, to clear it, to fight with it. So the immunity is the white cells which are coming in and they start to work. And they're coming in because there's a blood. So there's a blood flow, there's the capillaries, there's a life in that bone. So we were removing the implant. It was lots of dead tissue, lots of smell, and it was lots of release for this client really straight after. Then we have the check-in session after 2 months. And after 2 months, we are testing the stability of the implants. And we are just checking in, asking everything is with the client. And she said, things are much better, but she still feels some sensations. And I always explain to clients, and I have that with the titanium implants, really, that the immunity or the body, imagine that you have 10 years titanium implant there, that nothing would change in with a magic wand in a day, that we replace everything. What we're doing with plasma concentrates, which we're adding to that side, is that we're bringing in the acute inflammation. We're bringing all the goodies, all the good cells. The blood concentrate is full of growth factors, which are in a chain or way of creating all the bone cells and tissue cells. So, there is life, there is immunity, which is clearing the infection, inflammation, the pathogens which were once there. I think the major thing or major turn around I have seen when I saw this client 4 months later, because she is coming like a new person. And she's very relaxed. You see it really in a way she comes in a way she interacts. She's a different person. She's very calm. Yeah, so I'm asking what is happening, what's happened, what are the experiences she has experienced. And she said that it's great that she has lost, and she is using this term, she said she had panic attacks. So, of fear and of pain. She said in wintertime, it was not possible for her to be walking out without pain. It was not possible for her to have not covered the area of her face. It was very painful to the cold, and she has basically pain all the time. Now, she said it's almost gone. She said the biggest thing for her is that the panics, fear, and pain is gone. And also what I loved, because she's regularly going to BICOM, to specialist, she said that always before there was a blockage in that area, and the blockage is no more there. So I love that we have the data, we have the findings, we have the evaluation on the site on this level as well. I have to say that we will start measuring with electroacupuncture the meridians within the operation. This is a beautiful idea which one of my colleagues, she is doing in United States, which I got inspired, which is amazing. So you can really see in the surgery when the meridian is clear and reacting. So I love that. And I love that this client, she's saying that the blockage is gone. And she's so beautiful that we sent her a packaging of the implant. She wanted to test on Vicon whether she is okay with this material to place in her body. So she did this and it was great. She also was taking a little piece of the zirconia filling, which we were placing in. And that was beautiful also. That was good for her too. And I have few experiences like that with other clients that they wanted to take a sample of the material and test it before because they have really health challenges and they are testing it with Vicon, which is the frequency, which is great. And yes, so totally different person, calm, relaxed. And I have to say this is all connected to nerve system because it was loaded with stress. Not a lot of people would realize that the chronic inflammation is bringing us to stress. It's not only the stress and the pace we have in our lives and, the aspect of life, which is bringing us stress, but it's also chronic inflammation in your body. It's just like kind of holding you in a fight state. And this is clear what is happening with our clients. We have lots of clients, they're saying the nervosity is gone, the panic attacks are gone. And it's not only with titanium implants or dead teeth, root canal treated teeth, but it's also with amalgam fillings, mercury fillings, or black fillings. We are removing, replacing with zirconia. So I would like to stress that this is all about how to balance the neurosystem. It's how to support the body because this client is supplementing. She was supplementing before. We are using the bone healing protocol. So lots of supplements which are supporting the body. We are testing and we're taking the data whether what is the vitamin D level. In her case was a little bit lower. I remember in summer she was, I think, just 60 nanomoles. And we like clients to have 150 to 200 nanomole of vitamin D level for healing. So we have approached and we have added that. And I believe she was using the supplements from Germany. But it's just the work of the client, really. So how you get ready for the surgery, for anything which you're dealing with in your life, that the results depends on that. So I love this story. I will post some photographs as well once I have them, and I will write the story also on our Instagram. One more thing, what I like to say also is the symbolism of the teeth. I started really reading the symbolism of the teeth also to clients because I believe that the healing is like a big puzzle and it's a huge, about awareness of things. So in her case, the lower left molar where the implant was about self-love. Just reading that, and I love to say that because I see in other clients that's really bringing the results as well with healing. Also, we can recommend some craniosacral therapy or something which is releasing the neurosystem, which is kind of helping with the healing faster. So thank you for listening to Healing Through Dentistry podcast. I'm happy to share this client's transformational story, and I would love to see you next time. Take care.
Thank you for joining us on Healing Through Dentistry podcast. We hope today's conversation has inspired you to see your smile as the gateway to whole body well-being.
To stay connected, visit us on our website or follow us on social media.
If you enjoyed this episode, please subscribe, leave a review, and share it with someone who could benefit.
Until next time, remember, healing starts with a smile.
Take care,
and we will see you in the next episode.